Hi,
Hi.
everybody. It's Susan Clinton and my co host, Erica Mello. And we are ready to bring to you podcast number 101. And so we've made the 100 mark. And thank you again for all of your reviews. We really appreciate it. We made it. We actually made it over 100 reviews by 100 episodes last time. So thank you. Erica and I are going to be going through and randomly pulling three names of people who had sent us a review. And we will be sending you our webinar. So stay tuned. We'll have that ready for you by the time the next podcast comes out.
Yes.
We also want to remind everybody that our monthly subscription plan is coming up. We're in the process of creating it. Erica and I are both very excited about it. Erica, you want to jump in and say anything about that?
Absolutely. So the people who listen to the podcast regularly, the podcast will still come out like it normally does. The membership will include obviously that, but we're going to have extensive show notes. Plus, we're going to have two separate podcasts, two additional podcast episodes. One will be like an Ask Me Anything Q&A with Susan and myself, where you'll be able to submit questions and we can answer them live on the podcast. And then we're going to be interviewing some really interesting therapists, healthcare practitioners that are doing some wonderful things in the world clinically, and there's some really great stuff going on, and we want to share that with you. So you'll be getting the show notes plus two separate extra podcasts as part of the subscription. So just look out for that, and it's great. We're moving onward and upward, Susan, which is
Yeah,
good.
yeah. And so as long as you have as long as you're in the membership, you have access to everything that's in the membership.
Yes.
So if you miss something, you have the opportunity to go back and listen to it or go back and grab other show notes and things like that. So you just need to be able to gain membership to be able to do that. And we'd love to have you there so we can share and actually give you the opportunity to ask questions, which are great. And on that one Q&A thing, we're also going to offer a hot seat. So every month, somebody will be able to get on and have 20 minutes with us, and everyone can listen and kind of hear, the clinical reasoning and the questions and the things that way as well. So, okay, thank you very much. I hope you all enjoyed the podcast number 101. We're on our way, marching up to 200 now. Thank you. Hi, everybody. It's Susan Clinton and Erica Mello, and this is podcast number 101. And it's Sunday. It's July, well, not July yet, but it's been kind of a hot summer for those that are quartered in the Northeast and in the Pacific Northwest this year. I think the middle of the country is getting quite a few storms. It's been quite the weather events this year. But we're cool and comfortable in our own little abodes today, and we are going to talk a bit about a client of mine that I wanted to share on this podcast. So, Erica, hello.
How are you? Yes, looking forward to, as we mentioned in the intro, another 100 more episodes. So it's great. I'm looking forward to hearing about your case. So,
Yeah, great.
yeah.
Okay, so this is a person who was referred to me with SI joint pain and dysfunction. These are her words. She's a 70-year-old female. She's a retired physical therapist and has worked in skilled nursing arenas and hospital arenas for most of her career. She retired about 6 years ago. 15 years ago, she started having pain in the back of her pelvis, and she reported that it kind of just came on. She wasn't really sure if she was doing anything. She thinks maybe she was pulling something in the garden. It was one of those kind of little nagging things that she thought would go away. She went to go get some physical therapy. Being a physical therapist, she went and sought out some physical therapy, in which she was told that her SI joint was out.
Oh boy. God help us.
Yeah, here we go, right?
Oh boy. Yeah, they still say those things.
And so they did maneuvers, is what she called it, manipulated, and she would feel better, and then she would stand up and start walking around, and it would go right back to the way it was before. And this has been the story for 15 years. So she's been up and down. She was at a point where she was really not doing hardly anything. And she went to a physical medicine MD who did some injections. She said they were a mild benefit. But one of the things that he told her was, he said, you really need to start moving. You have to get moving. Part of what's happening here is that you're really, there's a lot of fear going on, and maybe, what is it that you can do that feels pretty good. And she said that I told him at that time that I felt like I could walk some, and but I really missed gardening. And so he actually sat down with her and went over some ways to garden, so that she could, bring the garden up to her and do some different things. So that was her beginning to kind of having a peek into the biopsychosocial from this physical medicine MD, which I thought was, brilliant on their part. She continued to pursue this idea that her pelvis was out, and ran into a couple of other practitioners that continue to do some of the traditional, I think everybody knows what they are, trying to move, she said, I have a posterior anomament and an upslip of my sacrum, and we get one better, then the other gets worse. And, just the same story, still
Very,
chasing this idea that things are out.
yeah, yeah, yeah.
So I just asked her, I said, before we even go any further, let me just ask you some questions. Of course, here's my 3 questions that I always ask. So, what do you think is going on? And she said, again, I really think that it's, I said, based on what physician told you and the physical therapist have told you, and your inside beliefs, what do you really think is going on? She says, I think I have an instability that just can't be fixed. Okay.
Oh boy.
And he said, is there anything else going on? Well, I don't bend over, and I don't half kneel with my right leg up, because I don't do anything that moves that anominate in a backward position. Okay. And
Innocent.
so what do you want to achieve? Why, well, I was referred to you because I heard you do things a bit different, but you have all of these great skills. And everyone said that if anybody could help fix my SI, it was you. So she's looking to be fixed.
Oh boy.
Loud and clear, we're looking to be fixed, but she wants something that's going to make her SI more stable. That's her thing.
Yeah.
And what are and so again, in your heart of hearts, what are you really seriously worried about? What's really underlying this here? And of course, the non-activity and not being able to move and enjoy her life. She goes, I'm 70, I'm very healthy. I should be able to be doing a lot more than I am. So that kind of gave us the opening. I had sent her all of the questionnaires as well, and she
Mhm.
scored pretty high on the CSI. She scored pretty high on the fear avoidance. She scored pretty high on the kinesiophobia scale.
Mhm.
It was interesting, the stuff that she scored high on the CSI were things that were really centered regionally. There was not a lot of the ideas of headaches and widespread pain, and some of the things that you see with central sensitization she wasn't having. It was really sensitive, and it sounds centrally driven at this point, but it was really regional based, just the pelvis hip kind of area. And then the fear parts and were, and the anxious parts were all about, worrying about my pelvis being unstable, worrying about my hip popping out, things like that. Just
Yeah.
these thoughts that are these, what do they call them? Thought viruses that were really
Yeah.
kind of, plaguing her and driving her motor system. So I just said, well, what did you think about the questionnaires I sent to you? Have you ever seen anything like that before? And she goes, no, this is all new. We didn't do any of this when I was practicing, and but I didn't practice in this kind of arena. So we just kind of talked about it a little bit, and talked about what we know about pain neuroscience education. What did she know about it? Not very much. We talked a little bit about kind of just reframing her situation just a little bit, and about tissue healing, because she does understand that. And perhaps what would it mean to you if the tissue was actually healed. But we heal tight, we heal loose, we heal weak, we heal with muscles that overcook and things like that. And she was interested in all of that. She was still the very idea touched on, let's fix this. So we kind of went through a little bit of that, and I gave her a chance to kind of talk and explain and get some more of her fears out and things like that. And I said, well, let's tackle a few things that, let's just take a look at some things from head to toe since no one has really done that. Let's do things differently this time. So she
Mhm.
was open to that, which was great. So I had her stand as usual and just took a look at her and asked her right then and there. I said, "Are you having your familiar type of symptoms?"
Mhm.
And her answer was, "Yes, I am." And so in standing, I just asked her, I said, "Where are you on your feet?" My question is, I don't pay a lot of attention to what that posture looks like it's a bad posture, but I do want to know if they have symptoms and kind of where
Yeah.
they are so that as we make changes, they kind of understand what we're doing here. And just to be, to let you know, Erica, when she was standing, it was very interesting because she was, you could tell she was back on her heels and had that little bit of that kind of, thorax that kind of goes backwards with the forward head. But it was the thorax was shifted to the right
Mhm.
pretty strongly,
Yeah.
and
Yeah. You know,
I
no,
asked
I
her,
was,
yeah,
go
go
ahead.
ahead.
I was going to say that it's so interesting when you see patients who are significantly either really farther forward or posterior. You've got either that posterior translation of the thorax or an anterior translation, but they're often shifted. Once again, relevant, we don't know, but if she has issues in standing, maybe it's, just it goes on the area of you know, just make sure you just look at that, so to speak, right? And I
Mhm.
just had two questions, Susan. When she got injections, with the physical medicine doc, was it Prolo or was it Trigger or
It
Saline
was
or
it was just, injections to stop a pain.
okay, got it.
So, just to see if that would help,
Yeah, yeah,
and it didn't really help at all. But no, it wasn't Prolo. She didn't go down that road,
okay,
and she didn't, and it wasn't trigger points.
yeah, okay,
He did an injection right into the joint, uh,
got it.
to see if it could interrupt or change
Yeah,
any of the
yeah,
stuff, which is why he afterwards, when she came back for the follow-up, that's when he talked to her about lifestyle and changes and some other types of medicine for her because he, he didn't feel that the joint was that the joint
got it.
itself may at one time have been a generator of symptoms, nociceptive, but he felt it was much more, you know,
Global.
lifestyle is medicine now kind of thing, which in the terms with the International Pain Society is nocioplastic versus nociceptive. And, so it could have started out as a nociception from the SI joint can be a nocioceptor, generator, but in this stage, she's kind of moved into more of a nocioplastic, which is much more of the, centrally driven type of symptoms and, things that go along with that.
So she
So,
was posterior and to the right, you
yeah,
said?
she was posterior
Okay.
and her trunk, her thorax was shifted to the right. So it kind of made her look like, like her right arm was far away from her body, her left arm was close to her body, little twist of the head to the left, just kind of that pattern that you see sometimes in there. And so all I did was I said, let's just play around with your feet a little bit. I want you to just tell me where you are on your feet. I'm on my heels. I said, are you anywhere else on your feet? Like the inside, outside, big toe, little toe, whatever. And then she was able to kind of say, yeah, I'm actually kind of standing on the outside border of my right foot, and and so I just let her kind of tune in and feel that a little bit and get used to that. And then we just said, I just want you to put yourself in a position to where both feet are equal on the floor, toes, heels, sides, arches, everything, so that you're just equal on the floor. Like you don't feel one foot more than the other or one part of one foot more than another. You feel most of both feet together. So I let her play around and shift around with that. And there was a lot of over shifting that went on. She really like shifted way to the left and way, but I just kind of let her play. We talked a little bit while she was doing it. And then she finally kind of got herself settled in. And I said, how does that feel now? And she actually, it was really interesting. She said, I think this is like crazy, but I actually feel better. So
Awesome.
it was wonderful. What a change right away. But she
Exactly.
really did like all this crazy over shifting stuff. Like it was hard for her to make small, little, easy ones. So we played with that some more. I said,
Yeah.
okay, go back to where you were, and she, did. And I said, how does it feel? Yeah, I feel it. Come away from it. I can't believe that just making this little bit of change makes a big difference, and so we again kept playing with it and putting some variety into it, trying to rewire around a little bit.
Mhm.
And took her over to the wall so she could put her hands on the wall, because I wanted to kind of get some input into that trunk before I put I was avoiding putting my hands on her as much as possible because of this dependency on somebody else to fix her.
Mhm,
Wanted
mhm.
really to spend that first visit really giving her the tools to kind of explore and get curious and change herself. So
Yeah.
we went to the wall, because what I would have done, Erica, I wanted to put my hands on her thorax so bad,
Yeah,
and
yeah.
just kind of start like playing with it a little bit to see,
Right.
but I avoided that, and so we went to the our friend the wall, which was great because when you put your fingertips on the wall, you can't. It keeps you from shifting through your
Right.
thorax, and
Centers it.
so yeah, and that was interesting for her, the feedback in there. She goes, it's really hard for me to stand and have and I said, push into the wall a little bit with your fingertips, like push in. So we straighten the elbows, arms at shoulder height, just put in, fingertips on the wall. And I said, just give a little push into the wall and let's see what happens. And when she did that, she actually could get straighter. She could feel the
Hmm.
difference. She could feel like it was hard for her to shift, on her feet, like she was without the wall.
Mhm.
But I wanted her to feel that with the wall. I said, now get your feet where you were when you were standing without the wall. And it was very difficult for her to do. But as she pushed into the wall a little bit, she was
Mhm.
able to achieve that.
Yep. Yeah, no, I was going to say the wall's great. In some way you can make it, you can, whatever explanation you want to give the patient, it gives you a sense of center. It restores better patterning. It trains the brain, whatever, with the tactile input. And especially since she had the issue in standing, like right then and there, you got the symptom. Why not make the change immediately to get the plasticity in the brain going, right?
Yeah,
You know?
exactly. Standing a lot was a complaint of hers, you know,
Yeah.
standing for too long, standing in the grocery store, bending over. She just never does it. She couldn't tell me if it hurt or not. She goes, I never bend over. I was told never to bend over. So she had those kind of beliefs in there. And so what I'm trying to do a little bit with her is violate some expectations. And one of her expectations was is that I'm going to fix her. So I wanted to immediately establish an alliance with her that was going to be, we're going to work through this together and give her the tools and the curiosity to, explore some movements that she's been afraid of and to make some changes. But I thought it was interesting with the arms and the thorax. And so we took the arms down and I said, let's do some more fun things. Let's stand on one leg, stand on the other leg. And, she had trouble standing more on her uninvolved side
Mm.
because she was so shifted, like over shifted, onto her involved side.
Ah.
So back to the wall we went, gave her some input, and she could stand better on both legs. So, my next thing was, okay, well, you're not always going to have a wall. Let's figure out how another way we can do some things. So we grabbed the TheraBand and, put it around her wrists and had her, I just said, her arm, I said, just bend your arms and, have her hands were kind of like around by her face, so we were just that much flexion of the shoulder and elbow, and then I said, just push against that TheraBand there
Mhm.
and let's stand on one leg and stand on the other leg. And it really helped a lot.
Yeah.
So she's starting to get the idea that, maybe I said, maybe it's not an instability problem. It's just that you have a motor pattern that is so set up here that it's hard for you to get out of it. But when we do these other inputs, you can make some changes.
Yeah.
And so that kind of started her, she's still fixed on me doing the manipulation, but she's kind of buying in a little bit here. So
Yeah.
we did some standing, where like marching,
Yeah.
in that position, not high, not crazy, just kind of like, just kind of get a feel for it, let it get into your system. Let's move around a little bit with it.
With the
And
TheraBand around her arms, she was
yeah, with
marching.
a TheraBand around her arms. So we
Okay.
just kind of, did some standing on one leg, some moving, some weight shifting and things like that. Then I took the TheraBand away and we played around with, again, I was trying not to get onto her thorax. And I said, let's do 3 deep breaths and see how you feel. So she did. And I said, I just had her feel it. I said, just tell me where you feel the breath, and she just kind of said, I just feel it like up high here, and I said, put the TheraBand around your arms again, and let's take 3 deep breaths. And you could really see that her thorax would just move more with the breathing when she had the input
Great.
her arms. So we're just, again, feeding that new kind of thought process into her that she could do that. And so the next one we needed to conquer was bendovers.
Okay.
And so I just basically asked her, this is how I got her into it, because I knew she was going to not want to bend over. And I
Yeah.
said, show me how you garden.
Yes.
I said,
Yes.
show me how you garden. And she immediately dropped down onto her right knee with the left leg up, like half kneeling.
Yes.
Because I do everything from this position, and then she started doing all these movements, like I'm kind of doing this on camera, no one can see me, but she was like leaning to the left and leaning to the right and bending forward and showing me, her hands moving and everything in that position, in that half kneeling position.
That's hard to
Yeah,
do.
she can do. And I said, this is amazing. Look at how strong you are and how, your ability to move in this position. And she thought it was, she didn't have good thoughts about how that was. She thought it was like, this is what I do, this is the only way I can do it, was basically the way she was talking. So all I gently asked her, and I said, what would happen if you just switched your legs?
I was just gonna ask it.
Give it a
Yep.
try. Switch your legs. And she did. And I said, and do those movements again. Well, she wasn't real good at it because she hadn't done it.
Yeah.
But she could, before she realized it, she was in a half kneeling position with her right, with her right knee up. And, so the pelvis was going into posterior rotation,
Right.
but
Right.
she wasn't having symptoms.
Right.
So she
How did
was,
she, I'm sorry, go ahead.
go ahead, ask
So
me.
how did she get up out of that? So if she was left knee, like right knee behind left knee and kneeling, you would assume she would have gotten up with a left leg push, which would be counterintuitive because she's so dominant on the right side in standing,
Right,
right?
right, right.
It's very interesting
It
how
shows
that
you
she
how, again, violating some expectations there, is that
yeah,
she couldn't do this, but she could do it. You can do it here. Why can't, and so that's why I said, what would happen if we switched legs?
yeah,
Because I'd already set her up to see that, she could do things differently than she thought she could.
yeah, with the
So she was
wall.
willing to try it. And then I said, so when you go home, one of the things you can do is play around with positioning with your gardening and do things a little bit different. Well, this is interesting because I was told never to do that. And I said, yeah, but we're figuring out now that maybe some of the things that you were told never to do was what they wanted to do in the beginning when you were really acutely hurting, just to calm things down. But it wasn't meant to last forever in your life. Things that served you before are not maybe going to serve you as well now. That's the way I did it, because I didn't want to say these people, told you wrong. I don't know. I wasn't there. Why would I like even, go down that path with her? And I don't want her to be feeling like she did the wrong thing too. It was like, what served you once in the past, isn't really, maybe isn't the thing that's going to serve you now. Let's figure out what's going to serve you better now. And I think kind of challenging some of these movements that you've been doing a little bit are helping without pain.
Mm-hmm.
And so then we just went ahead. She wanted me to do something. Will you please at least just push on my back or my pelvis and tell me what you feel? So, I
Can
did.
I
Go ahead. Mm-hmm.
the question? Did you play before we do that? Did you play with like narrow, normal, wide positions on the wall at all yet, or like
Not
hand?
yet.
Okay,
Not yet. So we
okay,
didn't vary too much because I was really just trying to get the buy-in and get some simple concepts, across to her.
okay.
And I wanted to, because she loves gardening and she
Yeah,
wants to walk. So I chose those two, the standing,
yeah,
and I chose the gardening because it was also going to bring a little bend over in
yeah,
without her realizing it.
got it.
So, she got on the bed. I did some PA glides. I did, some PA glides on her, SI. It didn't there, it was fine. There was a lot,
What's
I told her, I
symptomatic?
said, there's a lot to, is it sore? Well, it's a little sensitive. Yeah, it's a little tender there. And I said, yeah, that makes sense. But I said, everything's like bouncing and moving, which is really good. I said, but let's do this. That you said that every time somebody, did something to you, you would feel better, and then it would be, then it would go right back. I said, well, get up and I want you to go for a walk right now. And so she went out into the, our big room and walked around a little bit. And I said, just feel it. It's okay. Don't judge it. Just feel it. Just feel what's going on. Feel where you are. Feel what's happening. And I said, now come back to the bed. And so I had her lay. I'm pulling up my notes. Hang on. So I had her, yeah. which side did I have her laying on? Yes, I had her laying on her left side
Her
and
right is
into the
symptomatic.
bathing suit pose, right? So the left leg was straight, the right knee was bent on purpose, right? Because here's that flexion coming in. And I had her put her right hand on her rib cage and her left arm up under her head, so you're kind of like laying on your side in the bathing suit pose.
Like a lumbar roll.
The direction that people come in to do mobilizations and manipulation. And I came in and I said, all I'm going to do is put my finger right here where you said you were tender. And I said, just get yourself in a position where you can feel that tenderness. So she did. She kind of like moved around and shifted around. And then I just said, so now in this position here, just leave your knee forward and all you're going to do is just rotate back with your trunk. And so I basically had her do the mobilization. I did not do it with her. Yeah, she wanted that. So it's like this, but I did it on, she goes, well, everybody else did it on the other side. And I said, well, we're not everybody else. We're going to do it different. So, because I was looking to get what? Rotation right,
Yes.
the
Yes.
trunk, because she
Yes.
was rotated left, and shifted.
Correct.
I wanted her to go in a different direction. I just wanted something different.
Translated right and standing and rotated left.
But I also wanted to violate an expectation and have that right knee bent, right hip and knee bent, so yeah, the thing that she never does, although she sits, which is like, so we got that going, and then I added breath in, so now take a deep breath in and just kind of let yourself relax over. We did it a few times. We came back, I said, wiggle around, see if you can feel it. Yeah, I can right here. Okay, then go back and do a little bit more. So I just kind of like coached her through it. And then after about 2 or 3 of those, I had her get up and I'd go for a walk. And she felt so much better, and it was great. And I said, see, does this help understand that maybe it's more of a patterning than something being out? Because we really didn't push on anything or do anything. All we did was change the way your muscles are working, in different positions. So she was able to kind of grasp onto that. So we kind of just went over the exercises, which is standing with the TheraBand around her arms, doing some one-legged stuff, some marching. We reviewed the gardening, getting on but one knee or the other knee. And and then we did, and she went over the bathing suit pose again. And I said, and so I want you to go and play with these now at home and get curious. When you have pain, I want you to think about what you can do to change what you're doing and see if you can make it better. So that was the homework, to go home with those things. Any questions there before I tell you what we did?
No, I just agree. Comment. I mean, it's so funny because the her pain generator, may have been the SI joint, but at this point, it's not like, what's the impairment? Is the impairment a loss of control? Is the impairment fear? Maybe all of the above, but with the variability in the movement, because you're like not the first therapist you saw. So at the time they get to you and me and the other people who see these challenging patients, you have to do something that's meaningful for them. You need to make the evaluation meaningful. And you did that via the gardening and just, the therapeutic alliance, right? Building that therapeutic alliance and making it meaningful for them. Because if someone came in and just did bend backwards, bend forwards, bend side, bend this, here's some exercises, she would never have come back, right? At that point. And I think it's so important, especially when these people are out there wits ends and frustrated. And yes, she has some, I need to get manipulated thing, but it's making it meaningful for her will really raise the odds of that person coming back for another visit.
Right. And I really wanted to help her begin to understand that she had the power within. She knew what she wanted. She just didn't know how to get there. And the only vehicle she knew was, a biomechanical model. And, her pain at this point is really more nocioplastic and less nociceptive. So we really needed to kind of start to change, so meaningful movement was important, but also kind of just really getting her to be able to do it and get curious about it. And, so anyway, so she came back a week later and wanted to have all kinds of articles. I need to know what you call this. I need to know what this is. I'm telling everybody about you because, but I want to read articles. So, she didn't have any of the knowledge about, like even the disc studies and, the NEOA studies and any of that stuff about, how, findings on MRI does not indicate, symptoms.
Right.
You can have symptoms and have very clean MRIs, just that whole thing. So I promised her I'd send her some different articles, and I did. But mainly what we did was I just said, just tell me what's going on and tell me what you're working on. And so she did. She showed me, how she was doing the standing and the stuff. And she goes, I notice when I'm walking, when I get really tired, that I started paying attention to where I was on my feet, and I'm really kind of like leaning off to the side again. So I really kind of paid attention to, she made up a little game of kind of just paying attention to her feet and trying to get her feet to be even while she was walking.
Yep.
She, when she did her one-legged stances, they looked very nice. She didn't need the TheraBand
Oh,
anymore. She didn't really
fantastic.
need the input anymore. I mean, she really like took hold of this and embraced it. She still wanted me to like look at her back as a manual therapist. She still had that piece. So we did. I said, okay, so let's take a look and let's see what's going on. But before we do that, let's do something else. How's bending over? Well, I don't bend over. And I said, pick up your shoes for me. So she did. And I said, okay, did that bother you? Well, I worry about it all the time because they tell me not to do it. Okay. And I said, well, let's play with this a little bit so that you can feel more confident, because you got to get stuff up off the floor. I mean, so I said, let's do it like this. Let's get back down on the ground again, all the way down on the ground. Pretend like you need to sit flat on the ground for gardening.
Yep.
And
Yep.
she was very nervous about that, but she did get into half kneeling, and then she did manage to get herself down onto the ground. And I said, now get up. Use anything you need to do, but go ahead and get yourself up. Use the bed, use a chair. I don't care. Tell me what you need.
Right.
So she wanted the chair. So she just kind of turned around and got into, full like kneeling. and then one leg and the other leg, and the legs that she used to stand up on was the right leg.
Yes.
She had right-sided dominant, but it was also violating expectations because she never kneeled before on with her right foot, with her right knee up. And so she was able to push up. And so we talked about that. And I said, that's amazing. Look at how different your body is moving now, and the confidence that you had to just put that right foot down and push up from there. And she didn't realize what she was doing in that context. So she was willing to kind of play with bending over then at that point. So we did I said, let's play with bend over to get down to the ground. So she did. She, instead of bending straight over, I said, let your knees bend. You don't have to bend with your knees straight. Oh, that feels so much better, less threatening. And I said, so now can you like bend over, let your knees bend, put your feet on the ground, your hands on the ground, like, kind of crawl down to a quadruped position. So we played with that, and then she used the chair to get back up again. She just needed, it's a strength thing more than anything. She hasn't done this in a long time, but she was very enthusiastic because getting on the ground was important to her. And there are times when she really feels like she wants to be on the ground.
Yeah. Yeah.
So, and
Really.
then she said to me, I think I could actually go to a yoga class. It's like, of course you can. She didn't know how to get on and off she just really wasn't getting on and off the floor. So to her, that was out. She couldn't do it. Now she wants to go and try it. So she's getting much more curious. So she really wanted me to push on her back again. So I said, okay, but let's do it this way. So I had her lay on her tummy, and I did my little PA glides, and I said, I'm sure, how does that feel? Well, it's still kind of sensitive. So, and I said, so what does that mean to you? Well, it means that there's still something wrong there. Okay. So we, I wasn't going to argue with her. I said, it's still an area of importance.
Yeah.
We can agree on that. The agency around that area is still very
Yeah.
important to her. So I said, let's play around with this just a little bit. What happens if you put your hands like you're going to do a push-up? I had her do, some trunk extensions, in prone.
Mhm.
And she couldn't go very far, and it was okay. We didn't need to go far. I just needed her to kind of get brave and try it, and she did. And I said, did that make anything worse? No. And I said, what about lifting your leg up instead? Prone hip extension. And that one she was worried about. Well, that's going to be a problem. And I said, but the problem's always been bending over, right? Well, I can't lift my leg up. And I said, well, let's just give it a try and see what happens. So she could lift the left leg pretty easy. The right leg she was just kind of struggling with. More of a motor control issue. You could see she was trying to shift her trunk to do it, and she couldn't shift her trunk. But she just couldn't motorically figure it out.
Yeah.
So I just had her, again, back to that the thorax. I put her hands on the bed again. I said, "Don't push up. Push into the bed with your hands.
Yeah.
Now lift that leg up and see if it'll come up." And
Yeah.
she was able to do it beautifully.
Perfect. That's
So,
that. Yep.
so that's it. So
Right.
that became for
Yeah.
her. I said, "You know what? Let's try a couple of things." So we did, and she did some of her feet changes, and we did some marching. We did some lower trunk rotations. We put the TheraBand in her wrists for the lower trunk rotations on her back. I said, "Don't push into pain. Let's just see what's going to happen." And then I had her lay back over on her tummy, and I said, "Now lift your leg up." And she could lift it up very nicely without even pushing her thorax in.
And
And I
did she?
said, "This is your new test exercise.
Yeah, like a self check or right, a self check.
This is your self-check movement. So if you're worried that something is out, something is sensitive, something doesn't feel right, if you've got that thought going through your head, I want you to do this maneuver here. If you can't lift your leg up, okay, then I want you to do your hands into the bed, a couple of nice breaths, and then lift your leg up.
Yeah, like that would be a reset
Better,
almost.
right?
Yep. Yep.
So I said, after you get done gardening, I want you to go and do this recheck exercise. Just lay down and lift your leg up. If you're lifting your leg up fine, then everything you're doing through gardening is working well. So she started to get it, like, oh, so after I sit for a long period of time, if it's hurting, I should check this out and see. I said, yeah, because perhaps sitting is not evil. It's just maybe sitting through pain is what we don't want to do.
Yeah.
When the pain comes on, your muscle patterning is going to be different. And when you can when you can get the muscle patterning to change, you may not have the same symptoms,
Right.
because your motor system is doing something different. So it's not tied to that pain response as much.
Yeah. Yeah.
We kind of played with that and worked on that concept.
Yes.
Yeah. She left wanting the articles, and I still think I want you to take a look at that. I said, okay, next time we'll take a look at your back again, and we'll see what's going on. So she came back in the next time, which was like, I saw her once, and then I saw her a week later, and then this is a 2-week. She wanted 2 weeks, off before she came back in. And she just said that, I'm just so amazed at all the things that I can do. I feel good. I don't feel like I have an issue as much anymore. I know what to do to get myself out of it. And she wanted to, talk about, getting on and off the floor again a little bit more. She was definitely going to go to a yoga class. She was nervous about getting up off the floor without using a chair. So we ran through some strategies, and she was able to kind of get in quadruped and then, kind of get back onto her feet and, kind of crawl up, on the floor by pulling her hands back a little bit and, getting in a crouched position. So the next thing we did was we started working on squats. And this is where, Erica, I got into the wide, narrow on the wall, the floor, and holding onto the doorknob. And we played around with a lot of different squats, because that's where she needed the power to get up and down from the floor, and gardening and some of those things. But she was really afraid of squatting, because she was told never to bend over. And I said, you don't have to bend over to squat. I know that you've been told that, but you've learned that you can bend over. You just need to do it differently. But let's do the squats in some different ways and figure out which ones feel good for you. So that's where we started on the wall and did some stuff, narrow and wide, and kind of playing with weight shift and moving. And then we moved into like a wall dog, where you've got your hands out straight and your palms on the wall, and kind of allowing her to go into some flexion at her hips, and just kind of retesting what happens if you bow your trunk, if you arch your back, just some things there so she could get comfortable with that. Was it better wider? Was it better narrow? She loved it wide, of course, most people do, less neural tension. And then we just kind of applied the same thing to holding onto a doorknob and going down into a squat, and then bringing her feet really wide into a squat and getting comfortable with that, and then trying the squat with the TheraBand around her wrists. that input into the thorax seems to be, there's such a thoracic driver with her.
That really restored better patterning.
Yeah. And so, and she got comfortable doing that. She felt really awkward at first. I said, go wide, because it's easier. And then she got to where she could do it without the TheraBand. And so then she had some strategies now. She felt like she could, because her knees are great. I mean, her hips move very well. It was fear and a lack of a program, a motor program.
Exactly, because if she's on a half kneel position and in a non-neutral thorax, I mean, rotating and moving, that's hard to do.
It is
You
very
sort
hard to do.
you need to sort of take a few steps back, but not take that activity away from her. So
Mhm.
that with the sagittal plane, squats, and one-legged standing, but and she could do that very well now, and so that would translate into that sort of non-neutral half kneel rotating. That's hard to do for the
Mhm.
system.
Yep. And it's interesting because when you get your clients doing some of the things they do, you may really see that they're doing things that are quite interesting, but yet they're holding themselves back from doing other things because of thoughts, beliefs,
Yes.
pain patterning around pain, and they don't want to feel it, so they take that all in and they just don't allow themselves to do something for her as simple as bending over.
Right, right. But
So,
what she was doing in the gardening was far more, what's the
Mhm.
word? It requires a lot more control in the system than bending over, but that's that disconnect, right? With the belief system.
Yeah.
Yeah.
Anyway, she's great. She's moving along and she's very happy, and she no
So,
longer feels like she needs to be manipulated. She knows that I'm here if things go crazy, just I said, just give me a call, come on back in, we'll figure it out. But she's, enjoying the summer. She's really like enjoying her garden, and she's been off to a few yoga classes and she's really enjoyed that. And she's very proud of the fact that she can, get on the ground and, you know, and do some things, on the ground and sitting. She sits up on blankets. We played around with that a little bit too, sitting on the floor and folding up some yoga blankets underneath her made her more comfortable. Just different bodies haven't been on the ground. You have to do some different things, to get people
yeah,
used to kind of in these newer positions. And, and
yeah,
she, so I asked her, I said, what is one of the things that you really like, your big take home? She said, I learned that I need to not push through and be afraid, that I need to find a new way to do it. That was her take home.
exactly.
So it was like, that was a big yay.
Yeah, exactly. Well done. I mean, that's amazing. I mean, you think about our job, we're movement specialists. We need to give patients just different strategies for movement, better options, and they'll choose, their bodies and brains will choose what's right when given the right direction, and when you take them out of a dominant movement pattern, it's okay if she bends on her right leg, but you need to get her out of that pattern, or we need to get them out of that pattern and give them more variability versus just keep standing and standing and standing on the right leg. And so I think that for the listeners, for a home program, you did the basic with the TheraBand, one-legged standing, the squats, right? And then, I think sometimes if people are afraid, if I use the yellow TheraBand a lot as well. So, you can get them on all fours, wrap the TheraBand around whatever the patient needs. Doesn't have to be a TheraBand, but that works really well with the thorax. But once again, it goes back to what's important for her, and
Mhm.
yours were powerful questions, right? She was afraid, and you got her right immediately into the movement. That was, I like the word meaningful, but meaningful and her
Mhm.
fearful, right?
And motivating for her, because gardening was a big thing.
Yeah, and
Yeah.
then the self check of the prone on elbows with the TheraBand, with then the reset of the same movement, but with the TheraBand, and it immediately restored right hip extension. Is that a strength deficit? No, absolutely not. Why would you can't just hypertrophy a muscle in 5 seconds. It's
No.
a neuromuscular patterning deficit. So I think that's important for the listeners, is that you figure out what the impairment is, and if you have, let's say, is it a loss of control in the thorax? That's the driver. Okay, so is it a motor control issue via an overactive system, an underactive system? Is it a strength hole? And it wasn't a strength hole for sure. It was
So,
just, you know,
mhm.
it was more of a control issue. So
Yeah.
I think
But
it was
most definitely.
fantastic.
And so for the listeners out there too, I know you're probably thinking, well, what if it wasn't the trunk? What if doing the stuff for the trunk didn't help? Well, then, if the trunk wasn't the driver, the thorax wasn't the driver, then I would look for a driver somewhere else. My first thought was it was her feet, watching her standing. and doing the movement made it better. And I thought, okay, there's a foot driver in here. But as soon as I added the input into the trunk, with her fingertips and stuff, and she was able to do so much more and had so much better control, motor control, I realized that the driver was higher. Had it been a foot driver, we would have maybe played around with some taping. We would have done some different things on the foot, or maybe if it was a little bit higher, like into the hip, with the hip being the driver, or the low back might have been doing some TheraBand around the knees. So, I don't know, that you can do a lot of the same strategies I did. You don't have to do it the way I did, but, by adding, by just getting curious, okay, so when we changed the feet, she got better, but the trunk was still staying shifted.
Yeah.
Thorax
Yeah.
was still staying shifted. So I thought, let's take the shift away by putting her fingertips on the wall and see what she can do. And she struggled with that in the beginning until we
Yeah.
really started pushing through and really bringing some more, some intentional change into that thorax. Then she was able to kind of have some new motor control patterns around her pelvis, so she could stand on one leg easier and
Yeah.
without do weird shifting and different things. I remember in standing, when she was standing there and I thought it was the foot, she was really over shifting all kinds of places, trying to figure out where she was on her feet.
Right.
So
So that must have looked much better when after
yeah,
treatment, she's more centered into your posterior medial lateral. Yeah,
yeah,
you treated the driver if she's like that, right? She's definitely better on her feet, literally.
yeah.
So awesome. Great,
Thank you,
great, great.
everybody.
Thanks, everybody. Enjoy.
Drop your questions in. Let us know how you're doing, and we will see you soon in our monthly membership.
Yes, and our website, toughtotreat.com as well. We have our clinical pearls PDF, and Susan has a couple PDFs on chronic pain and sleep. That's the only way to get onto our newsletter is to opt in on that website with your email address. We're going to have a new website coming soon, but we'd love to hear from you. Hope you enjoyed the podcast. 102 is the next one. Bye.
Thanks, everyone. Bye.